Hey guys, it's Dr. Kentaro Ku, Clinic Director at True Lifestyle Wellness. Today, we're going to talk about inflammation. I know I've talked a lot about this in the past, and I don't want to sit here and depress you today, but I think it's important to truly understand what's going on in the world of healthcare today, because we have a huge problem here. I mean, just go to the mall and do a little people watching. The sheer amount of people, the amount of broken people walking around limping, people are slow moving, they're obese or overweight, they're fatigued. So we're so broken right now, and a lot of that stems from inflammation, all right, which I'm going to be talking about today. By the way, if you have questions, feel free to throw them in the comment section below. We'll try to get them answered as soon as possible. Now, if you look at the top 10 causes of death in the United States right now, the top 10 leading causes of death, 7 out of 10 have an underlying inflammatory cause. So I would argue that the leading cause of death is not heart disease, it's not cancer, but it's inflammation. Inflammation is at the root cause of heart disease, cancer, diabetes, stroke, Alzheimer's, respiratory disease, all right? And the list goes on, but there's 7. Now, if you look at the top, with the exception of like, let's say suicide or accidents, I mean, obviously it's not inflammatory related, but there's 7 out of 10 which are. And so the big question is, what spikes inflammation? Well, sugar. Sugar is a big one, and sugar culprits. Now, they put sugar in everything. You just have to look at your labels closely, right? So 100 years ago, the average American consumed 4 pounds of sugar per year. It was really expensive. It was a delicacy. Now it's 140 pounds per year. So they put sugar in everything. Just look at ketchup. Now, why do they do that? To make it taste great, obviously, to make things more addictive so you come back more and more, so you can buy it more and more. Just trace the dollars, right? So sugar spikes inflammation. Carbohydrates, all right. Carbs are basically sugar in disguise. It really spikes your blood sugar the same way sugar does. Toxins. Toxins spike inflammation as well. When I'm doing a talk, people are like, what about household cleaners? So they think of those types of toxins, but what I'm talking about is high fructose corn syrup, preservatives, nitrates, MSG, trans fats, colors, dyes, GMO type foods, aspartame, all the artificial stuff. If a food has 27 ingredients, it's not food, right? So get rid of it. It's made in a lab. It's going to do more harm than good. So toxins. Stress. Stress spikes inflammation. Dehydration spikes inflammation. Did you know that when you have a lack of oxygen in your blood, that stimulates the body to produce scar tissue, which is another form of collagen. It's called pro-alpha collagen. It's what binds tissues in the body, like in your joints and muscles, causing stiffness, muscle tension, and pain. Food sensitivities. These spike inflammation, obviously, and you've seen me talk a lot about food sensitivities and intolerances and how we objectively test patients to get rid of these inflammatory culprits. Nutrient deficiencies. Now, I'll talk a little bit more about nutrients too as we go along here, but they also spike inflammation. So my whole approach here with patients is to deflame and detoxify at the cellular level. So I want to bring down that inflammation. I want to detoxify the body. It's not a juice cleanse or a colon cleanse. I'm talking about, let's detoxify the tissues at the cellular level. Now, we do this through a specific 90-day detox protocol. So again, inflammation, you've got to watch that. You got to bring that sugar content down. You got to watch the toxins that you put in your body. You got to bring your stress levels down, and you got to be tested. And we can test for this inflammation as well. It's a biomarker called C-reactive protein. We can test and see where you're at if you are indeed inflamed. Then we put patients on a protocol to bring that down, hopefully. Prevent some of these more tragic conditions. My mom had thyroid cancer a year after I was born. My grandfather and uncle, Alzheimer's. My father has some heart disease going on. I'll talk more about that in another video as well. But we're on a mission to really educate and empower people to kind of clean up their diet. Let's do some objective tests. Many medical doctors, they're not going to dig. They will not dig deeper to find the root cause. All right. So what is the underlying root cause? That's the main reason why we're reaching out and doing these Facebook Lives, and to educate and empower people and get more sick people well. We'll just say, hey, you've got XYZ symptoms, let's cover it up with XYZ drug. Well, let's ignore the underlying root cause and let's just mask the symptom. That's not the fix, because then you have side effects for the first one, and now you're on medication number 2, medication number 3, and so forth. And I think the average senior citizen is on 13 to 15 medications, right? That's not right. And there's 10 of them covering up side effects for the first 5. So guys, we can do better. So please share this post if you're watching this on Facebook. If you have questions, again, throw them in the comment section. If you're watching this on YouTube, click subscribe to our True Lifestyle Wellness channel. So, essentially we want to help more sick people get better. This means you, your friends, your family members, your kids, maybe you have colleagues at work who are complaining about chronic fatigue or digestive issues or migraine headaches. Maybe you know somebody with like skin issues like eczema or acne. Maybe you can't fit into your favorite pair of jeans anymore. We're always creating more videos and more content to help people become healthier